All right. Hello, everyone. So, welcome to week 5. And this is where we get to sort of the real nitty gritty as to how different parts of your health are impacted to your rate of healing. And today's topic is going to be talking about how stress impacts your healing. So, again, if you're new to the group, today we're presenting it with myself. My name is Dr. Crystal Chanderban. I'm a naturopathic doctor practicing in Ontario, and Dr. Mark Hawass, which I'm sure you have probably seen him in person. He may have poked you with a needle at some point. So really, we really want to talk about those non-surgical treatments and modalities to help you basically get the results that you're looking to get to. So on the third slide, the saying of it's not the load that breaks you down, but it's the way you carry it. And oftentimes when we see people who, maybe have the same sort of environmental factors in their lives, one person might be handling it a whole lot better than the other person. And again, it's that scenario of it's how you carry that stress. Like you both can have the same load, but maybe one person is doing something slightly different. And we're hoping today that you get to learn some gems that you can take away with to learn how to carry that load far more effectively.
On that regard, just want to add something I learned recently, which is very interesting. If we stand up and I hold maybe a cup of water or any object, and you ask someone, well, how long can you hold it? Is it heavy? And they say, no, it's not heavy. It's like maybe, I don't know, a couple of ounces and so forth. But it gets heavier and heavier the longer you hold it. So it might be a little bit of a chronic injury, but the longer you mingle with it and it doesn't heal, it gets bigger and bigger and bigger. And that's what Crystal is going to allude to in a couple of next slides.
So inflammation typically gets a really bad rap in the media, but ultimately, like, we would not be surviving as a species if we didn't have this mechanism, because inflammation at the end of the day is a very natural way for the body to protect itself, and it fights off infection. And when you think of, for example, when you stub your toe, you'll notice that it gets very red. And so that redness is basically that blood flow coming to the toe that you just stubbed. And the reason why all that blood is going there is because it's part of your immune system coming to help heal the area and assess the area. And also it's generating that pain to let you know, I really don't think you should be walking on that toe for the next few hours. The problem in our society is that oftentimes we tend to ignore a lot of those symptoms, or we tend to have poor sleeping habits or poor gut health, which naturally will contribute to more inflammation building. And so in the next slide here, in controlled amounts, you can see that inflammation is like a fire. It keeps us warm, healthy, protected. It's like a campfire. But too much fire can be quite destructive. And so we really want to make sure that we're not allowing the body to be in a state of a low-grade chronic fire. So that low-grade chronic inflammation that is, sometimes you don't feel the pain, but that inflammatory process is still going on. And this is what we're trying to make sure that we take care of, and we can do that through a multitude of different ways. So ultimately, what is stress? And so stress is a psychological, so what goes on in the brain, and a physiological reaction, what goes on in the body, to a condition that you deem to be a threat or a challenge. And so, if we go back thousands of years ago when you were a caveman and, the big Wolverine came your way, you did kind of one or a couple of things. You either fought the Wolverine, you either stayed super still and you didn't move because you didn't want to be seen by the Wolverine, or you ran away, at which point you probably would have been killed by the Wolverine at that point. But your body responds generally to one of those three things. And evolution takes a very long time to take place. And unfortunately, our bodies will still react to everyday things in that same manner of, I still think it's a Wolverine. So that email that you get from your boss, that is somewhat alarming because you don't know if your vacation time is going to be accepted. Sometimes our body sees that as the same threat as, "Ooh, that Wolverine is there." And so we react to those levels of stress by releasing a set of chemicals and hormones. So we're going to go through the two major types of stress, so specifically the acute and the chronic sides of stress. So acute stress is when, an example of that can be, you narrowly avoid a car accident. And what ends up happening in that period of time is you get a short, small burst of adrenaline and cortisol. And then your body sort of reacts appropriately to that situation. After that situation has passed, your emotions and your physiological body, your heart rate, your pupils, all parts of your body return to their normal resting state relatively soon. So, what I like to, this example of the acute stress, if anybody has ever gone camping or has ever been involved with nearly hitting a deer, what ends up happening, and you see this all the time in nature, is when you slam your brakes on the car, the deer stands perfectly still, looks at you, and if you look very closely, before the deer then scampers off into the forest, it will actually have this rippling effect across its back body. And that's where the deer is actually discharging all of that adrenaline and cortisol that it no longer needs, because it's basically looked at the car that stopped and has assessed that it's no longer a threat, and now it's going to run off. Unfortunately, with us humans, we are a little bit more emotionally, I guess, what's the term? We have a lot more things basically that we're processing in our brain. And instead of doing the traditional discharge that those animals do, it's very common for us to hold on to a lot of that trauma. Now, if we move on to the chronic stress piece, you can think of that example as, constantly having tight deadlines at work, and perhaps maybe constantly fighting with your life partner that's at home, and you feel like stress is being hitting you left, right, and center. And oftentimes chronic stress can lead to an issue where your immune system is quite suppressed. And when your immune system is suppressed, that's going to play a role in that inflammatory piece. So that chronic low-grade inflammation that's basically there, lingering in the background, waiting to essentially take advantage of you when you least expect it. So, some symptoms of the acute form of stress. So, the pupils will dilate, so they get very tightly dilated so that you can see very effectively. Your heart rate will start to increase. You'll get sweating in the body. You might have some fast, heavy breathing, feelings of anxiety, and poor sleep. Those are some of the common symptoms that you'll see with regards to acute stress. Whereas when we look at the chronic stress piece, so that's where the people, as Mark had mentioned, where they're constantly holding on to those emotions, they're constantly holding on to those things that have led them to the acute stress, can lead to things like weight gain, insomnia, panic attacks, chronic low-grade headaches, cardiovascular disease, diabetes, and poor wound healing. And I'd even add here frequent infections. So I'll constantly see people who will come in the clinic and they'll tell me, at least, 4 or 5 times a year when I get hit with a cold or flu, like it hits me pretty hard and intense.
Interesting point just to add is, despite the acute stress might happen once and it disappears, but that's what Crystal mentioned initially. It's more psychological than physical. If you keep remembering that acute trauma and you keep repeating it over and over, visualize it in your head, tell your friends, tell your assessors, tell whoever, you keep reliving that, you technically amplified that acute and you made it into a chronic. Even though that might be a minimal physical distress with it, now you just amplify the chronic pain from an acute to a chronic situation. So that's why you need to block it at the mental level and mental head, where you stop talking about it unless it's within context. If you're seeing a doctor, if you're seeing a lawyer, that's completely different. But it's not on day-to-day basis. You talk about your injury, you talk about your pain.
Yeah. Um, yeah, it's interesting. It's kind of one of those scenarios where you put your attention to something it'll grow essentially. And so if you put your attention to that acute trauma or that it's almost like you're reliving it. And unfortunately, our bodies and minds don't know the difference. And so that's where we're going to talk about some tips to kind of help you navigate that. So on the next slide, there's been some very good data to show that the more stressed out you are, the slower your wounds and illnesses heal. And so it's really important that while you're getting work done at the clinic at Arthritis VIP to manage the healing of the joint spaces, that you're doing work on your own outside of the clinic to really implement that faster healing rates. And so some of the things that you can do, and I talk about this almost on the daily with every one of my patients, is we want to activate the vagus nerve. So the vagus nerve is a nerve that originates in the brain and has a connection to your ear and to other parts of your body. The vagus nerve essentially regulates how you breathe, so how deep or how shallow you breathe. It can